Awesome. All right. Well, thank you, everyone. Welcome again. Thank you for joining us. My name is Mark Coven. I think we have it maybe on one of the other slides. Here they are. Yes. Okay. So first, let's just make sure that you guys are all here, right, for the right information session. We did have one yesterday, which was for our Master's of Science in Nursing, which is our Master's Entry Clinical Nurse Program. That one is for those that have a bachelor's degree in another discipline and want to become nurses. So we're hoping everyone here today has at least their BSN, so it's completing their BSN, or maybe is going to be completing their BSN and or a master's entry program. So you may have also have something similar to ours where you will be completing your entry level degree. Okay, so this program is, we consider it or call it our post Bachelor of Science in Nursing program to our Doctorate of Nursing practice. So post BS to DNP. So again, for individuals that are going to be receiving their BSN or MSN entry level and are interested in our DNP program. As we continue, my name is Mark Coven. I am the Director of Recruitment, Outreach, and Admission, and I have the lovely Jamie Gama, who is here with us. We also have another team member, Natalie Asensio, who is actually out on maternity. So she had a beautiful baby girl, and so they are doing well at home. And so we are hoping for, a great recovery and that we'll be seeing her later on this year. The purpose of today's info session, again, is to provide you with information on this new post-BS to DNP program. We are happy to say that our inaugural cohort is getting ready to start with us in about a week and a half, almost 2 weeks. So we're excited for our first cohort to come and join us. And so everyone here today, hopefully will be thinking about applying for fall 2026, which will be our second cohort, or maybe 27 and so forth. So we're just happy that you're here with us. As you guys know, here at UCLA, we love using acronyms. Obviously, UCLA, University of California, Los Angeles. And so the same thing could be as you're kind of matriculating, moving through other programs here on campus, more specifically the DNP, right? So again, it's the Doctor of Nursing Practice. So feel free to use DNP. You guys all know that's a language out there in the nursing community. Okay, so you guys, I'm not sure if anyone has ever joined one of our information sessions. If you have, great. But I'm also going to apologize because I love using this example in terms of why you may be thinking about UCLA. And it really comes together in terms of the community and the resources that we have, which we feel makes us one of the top nursing schools. And so started off, right? When I say community, small community within a big city, that is pretty much what UCLA is. If we have any UCLA graduates that are here joining us today, you guys know how big the campus is, and not just how big the campus is, but what it has to offer our students, right? So again, for anyone that hasn't been in Westwood or on campus, we have our own police department, right? So campus safety. We have Ronald Reagan Medical Center, which is the #1 hospital here on the West Coast. So, we have that, which is amazing. We also have transportation, as you know. We have UCLA buses that come in and out, Santa Monica, Culver City, Metro. So no matter where you're traveling from, you will be able to get to campus. We have amazing places in terms of entertainment, if it's eatery, on campus or even off campus. We call it in Westwood or in the village and whatnot. So everything you think, you should have in terms of what a community should have and offer the people, UCLA has it. But if we were to kind of scale it back from a academic level or scale it back to an academic level, we like to say the School of Nursing is also a small community within, again, how big the university is, right? And other departments. So within the School of Nursing, we have tons of resources for our graduate students, from your faculty advisor, right? Who you'll have throughout the program, right before it turns into you asking for a chair in your committee and so forth. We're also going to be putting together a mentorship program, which is going to be for individuals that are going to be starting their first year, who are going to be being matched up with someone in their second year, right? Especially for this new program. And so, yeah, we like to have that where you're going to be befriending, someone, another student to help you, provide some insight of the program, if it's studying, if it's other cool things that, the program has to offer. We have other grad resources that we partner up with in terms of the university, in terms of tutoring and everything like that. And so what we want to do is just make sure that we have all the requisite resources for our students to be, successful. And so even though this is the second cohort that will be entering for the DNP program for the post BS-DNP, we did have a post-licensure, we should say DNP program for about 6, 7 years. And so we have the lovely Sue Kwan who's manning that program. And then we're going to have other amazing student affairs officers, Stephanie Dominic and Dr. Farnaz Sadat. So we have tons of resources from our faculty to our staff to the clinicals that we're going to be having you complete your hours with to make sure that we are one of the top nursing schools. Okay, so as we're thinking about UCLA, the School of Nursing and its philosophy, there are a few things that we want you to start thinking about, right, in terms of what it encompasses. So think about clinical practice, right, education, research, consultation, leadership management, and services to the profession and community, right? And so we want to make sure that we're hitting on all of these bullet points to ensure that when our students go through the program or when they graduate, they're going to be able to have these foundations that will set them, once they graduate with their DNP, continue moving on with their nursing profession. All right, so what does a DNP degree signify, right? So we want to make sure that it is part of the translated evidence-based practice, right, EBP, to the bedside, right? So you're thinking about the micro level. Also, if you were thinking about a macro level, right, is it assuming leadership roles in a variety of clinical settings within a complex healthcare system? As you guys all know, just how complex healthcare systems are, depending on what hospital you guys are at. But we also want to make sure that we're going to be providing the highest standard of care at the advanced level practice. Okay, so again, you're going to be thinking about the different NP specialties that we have that we'll get into a little bit later, but do know that it is at an advanced practice level. And then also making sure that you're going to be providing a professional doctorate for the nursing profession, right? That's going to be meeting the ever-changing and the ever-demanding changes, right, in the nursing workforce, as well as the changes in healthcare, as you guys know, and I'm assuming that's why we're all here today. Okay, so a lot of people, right? I think we're starting now to understand the difference of a DNP and a PhD, but we do love to, provide a few of these slides so that people do understand the difference between them, but then also making sure that it aligns with what you are, thinking about pursuing in the future, right? Okay, so what you want to think about is practice versus research, right, in terms of the career. So for DNP, you want to lead improvements for patients and system outcomes, but also note that it is the highest level of clinical nursing practice, where for the PhD is to develop new nursing knowledge and or theory, but it is also the highest level for nursing research. So both, but the DNP and PhD is the highest level in terms of education that you can receive, but one is about leading improvements for patient and system outcomes, and again, the other one is for developing new theories. As we are to continue thinking about the difference between the two, right? For the DNP and for the PhD, start thinking about these questions, right? And thinking about how you can help answer these within why you want to select the DNP program. So do you want to develop leadership qualities, system thinking, and improve patient quality and outcomes? And do you want to develop as a leader in your chosen area of clinical practice, right? So we all know you guys are currently in a specific hospital, a specific floor. So think about, do you want to develop to be as a leader, right, in that area? What is it that you would like to examine? What you would like to change? For the DNP, you want to think about developing critical thinking skills and expertise in a specific area of interest and provide new knowledge again, right, or new theory to guide patient quality and outcomes. And do you want to advance the science of nursing in a chosen area? So again, for DNP, we're thinking more clinical practice, right? Whereas for PhD, we're thinking to advance the science in nursing in any specific chosen area. Okay, so let's think about the curriculum, right? In terms of what it's like, particularly in most DNP and or PhD programs, but more specifically here in the School of Nursing. So again, for DNP, it's clinical practice, right? Where for PhD, it's the original research. Career paths, right? For DNP, right? You want to stay in the clinical area. You want to continue practicing, maybe working, still within a hospital or clinical setting. Whereas for a PhD, it's research or academic, as well as in either administration, right? When it comes to teaching. For background, the entry level is at least an RN, right? Or at least a BSN. Now, in terms of the duration of the program or for each program, For the DNP, it is 3 years, but you do come December in between year one and year two, or I should say finishing year one and then finishing year two. And then, so it's about a typical, 11 quarters, right? Whereas for the PhD program, it will be a minimum of at least 12 quarters, which is 4 years. We do like to say 4 years, but typically it may take a student 4 to 5 years to finish a PhD program. And then, okay, again, the skill focus, right? Translating research to practice to improve, again, patient and system outcomes, to improve health policies. And then again, for a PhD is to conduct theory-based research and develop new knowledge to improve nursing practice and outcomes. But I think one thing that we should be focusing on, right, is the work product in terms of graduating. For the DNP, it's going to be a scholarly project, whereas for the PhD, it's going to be a dissertation. So that is two things, well, not two things, but one thing to really think about as you're going through a DNP program is that you will not be doing a dissertation, but it will be a scholarly project. One of the next few slides, we'll talk about what that entails as well. Okay, so some growth trends. This is looking like now it's getting a little outdated, right? Goes from about 2007 to about 2022. But what we like to do is still keep it here to show you just the increase of DNP programs, right, throughout the country. So as we're seeing, there's been a huge increase. When I first started, I think in 2009, we would go into different conferences, nursing conferences. They started, talking about, hey, we want to start transitioning to a DNP. And a lot of programs were like, oh my gosh, yes, let's do it. And then some were kind of sitting on the hills taking their time. But as you can see, throughout the years, the emphasis of getting your DNP and advancing your degree and your level of practice has increased. And so we're excited to also be part of this trend as well. Okay, so some core competencies in terms of the DNP program. Some of these we mentioned already, right? But we just want to continue reiterating because these are the things that our faculty have put together, have built to ensure that it also meets the California Board of Registered Nursing, right? As well as the nurse practitioner. And so again, thinking about critical thinking, of course, evidence-based practice, the advanced professional role and development, clinical scholarship, communication, cultural competence, and ethical conduct. Okay, now we're talking a little bit about the guidelines for the scholarly project. So again, you will be doing that instead of a dissertation. So in terms of the scholarly project, here are some of the things you want to keep in mind. You want to make sure that you're going to identify a clinical area of focus within your specialty of practice, right? And again, we will talk about the different specialties that we do have to offer, and you just want to make sure that your goals align with what our specialties have, or what we have to offer in terms of our specialties. We do have to make sure that we're still following our graduate division guidelines, so the UCLA Graduate Division of Education, right? So in order to obtain your degree, we got to make sure that we're still following the same rules and guidelines that the university requires. And so that is a committee structure. Okay, so your committee will consist of 3 different faculty members within the School of Nursing. All right, and so one will be your chair, and then you will have the option of also selecting 2 additional faculty members. And then at the end, there will be a publication. So you will be, once you finish your scholarly project, it will go into publication. And so that is amazing. Also think about year 2 of your study. You'll be learning about IRB. And so that is where you're going to be getting the okay to actually do your research. Okay, so if you don't know much about IRB, that's totally fine. The way the program is set up is for each quarter and each year, you will learn in terms of how to submit a successful IRB to continue your research. Do know that there are both the qualifying exam, if it's going to be the written and or the oral. Okay, so you will have a written qualifying exam, which is basically like the proposal. And then you'll also have your oral defense of the proposal. Also, when it comes to the project deliverables, you're going to have your oral defense. It's going to be part of a poster presentation that you'll be putting on, as well as a manuscript. Okay, so the manuscript is scholarly project, which again consists of the poster and the oral defense. Okay, so here are just some recent DNP graduates and the titles that they hold. Again, as we're stating that we do have our new cohort, our first cohort for our post BS to DNP. This does not align with them. This here talks more about our post licensure DNPs that have graduated and that are doing amazing things out here. And so just to give you an idea of some of the things that they're doing, we have someone who's an advanced practice manager at CHLA, which is Children's Hospital of Los Angeles. We have a director of advanced practice at City of Hope. We have a co-director, Center for Education, Interprofessional Academic Homeless Pact, okay, which is at the VA. We have a stroke advanced practice provider manager at Stanford. And then we have a chief nursing officer and senior VP at the University of Washington. So these are just some of the cool things, again, that our graduates are doing. And so you may want to start thinking about potentially what you would want to do after graduating. Um, you may think about, hey, I just want to get through this program and then see where it takes me, and that's totally fine. But then what we do want to do is also encourage advancement in your practice as well. So just wanted to throw that out there. Okay, so if we were to put the curriculum in a pie chart, again, here are some of the things that we just talked about, right? So again, the core theory, which is going to be, right, your evidence-based practice, your education, your systems leadership, healthcare policies, and financial management. And then again, we just spoke about the clinical application, which is your DNP Scholarly project. And then here at the bottom, here are the list of the specialties that we have to offer our program. So first, well, in no particular order, we do offer the family nurse practitioner. Um, we're not sure though if we're going to be offering the occupational environmental health option this year. We're still waiting to hear back from our faculty, but we obviously will be offering the FNP, just not sure if the OC health will be part of that. We will be offering the adult drug primary care, okay, for, of course, the nurse practitioner. And again, we're not sure if we're going to be offering the occupational environmental health, but we did want to leave it up here just in case. But for anyone that is thinking about that, we will be sure to notify our applicants once a decision is made. But the last two, it's going to be our adult gero acute care. And then to finish that up, it's going to be our pediatric dual acute and primary care. So when you are getting ready to apply or thinking about applying, you will only be able to apply to one specialty. Okay, so there's not going to be an option of selecting two. So at the time of application, hopefully you'll have an idea of where you want your focus to be. And so, yes, there will be a drop down and where you will be able to select one of those four options. But we'll talk a little bit about that in the application section of today's information session. Okay, so let's talk a little bit about the written proposal, right, which is the qualifying exam. Okay, and so what's the purpose of it, right? It's to demonstrate the ability to integrate your knowledge, right, from each part of the curriculum. So ensuring that, what you're learning, right, you'll be able to, articulate that in a written form. And so typically what we want is to have that done as you finish year two. And then that will be read by your DNP Scholarly Project Committee. But for preparation, right, you want to think about the core theory classes and how that integrates into your specific, project focus, right? And so that's kind of the whole way that this program is going to be ran is you're going to be thinking about what your research interest is, and then you want to apply each class, right? And how that integrates into your project focus. So that's the best there. There may be times where you'll be with your faculty advisor and they may want to tweak, right, your focus, and that's okay. But hopefully you'll want to have that set as you start matriculating throughout the program, because as you're going through your classes and you're writing these different essays and these projects, you want it to be tailored and focused towards what your end goal is, which is your scholarly project, right? And so again, it's going to be the foundation again of your project in a clinical base in terms of inquiry, implementation, and analysis. Okay, and then there's going to be the oral qualifying exam, and that will begin during the fall of your third year. And so that follows again the passage of your written qualifying exam, right, which you'll do the year before. Then again, your committee will consist of 3 faculty members. All committee members must agree on your written and your oral, right, in order to make sure that you pass. And of course, that is not an issue. And then again, the oral defense, right, at the end is what your scholarly project proposal will be. So again, your committee members will consist of 3 faculty members, right, that you will help select, and then you will go through both the written, the oral, qualifying exam, as well as your oral defense at the end. Okay, so here are some DNP scholarly project designs. So this will help you in terms of where you would want your scholarly project to go. So think about these 4 areas, right? So there's quality improvement, which is the analysis of performance and develop a systematic effort, right, in order to improve outcomes. You can also think about translating evidence into practice, right? So it's the evaluation and application of best evidence to improve practice outcomes, or the examination of clinical or practice-based issues and implement that to the best evidence to make a practice change. Or you may think about program development and evaluation, right? So that's develop a program to address a gap in care and the evaluation of outcomes. And then lastly, it's healthcare policy, right? So that's going to be analysis of a policy to determine its congruence within the current practice context and possible policy modification and recommendations. So I'm going to leave this here for about 15 seconds to see if you guys want to take a quick screenshot of this, just to have an idea in terms of when you're starting to think about, again, what you would want to do as part of your scholarly project. Think about these 4 areas and how that may go together again with one of these options. So quality improvement, translating evidence into practice, program development and evaluation, and healthcare policy. All right. Okay, so here is a sample course sequence that we have for each of our programs. Again, sample course sequence, and then knowing again that the occupational environmental health might be one that will not be offered. Let's take this as it is, knowing that again, it could change for fall 2026, right? So what we really want to do is just show you a breakdown in terms of the classes that you'll be taking from year 1, 2, and 3. We also have this, and I think we actually have a more up-to-date one on our website. And so thank you, Jamie. Yes, there it is. Yeah, thank you, Jamie, for adding that. And so please feel free to grab that link, everyone, and you'll be able to download whatever specialty it is that you're interested in. This next one here is for the adult acute care. Next, we have the Peds dual acute and primary care. And, oh, did I miss one? Wait, go backwards, go backwards. There we go. Did I miss one? I did not. So sorry. Okay, FNP, adult primary, acute, and peds. Awesome. One thing, again, just to kind of reiterate as we're looking here, right, as you're seeing finishing up year 2, you're going to be doing your written qualifying exam. So the cool thing is it's going to be telling you each class, right? And then it's going to tell you when you're going to be doing your written, when you're going to be doing your oral, and then at the end, your defense. It breaks down each course into the units. It's also going to tell you what classes, and then it's also going to tell you what course is considered an APRN, which is an advanced practice course, and or a DNP course. So you'll see those in kind of parentheses. So again, please use the link to get to the most updated sample course sequence, as well as the specialty of your choice. Okay, so here are some common questions. And so hopefully these may also drum up some questions that you guys may have as well. Okay, so some common questions about the program. Is hospital experience required? So with talking with our faculty, hospital experience is not required, but it is highly, 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 highly recommended to have at least 1 year of RN experience. Okay, so again, you can apply if you have less than 1 year experience, but you have to think about, again, potentially what specialty that you're interested in, and then also the other number of applicants that may be applying that have more years of experience. I will say for this first year, for our students are getting ready to start, majority of the students that were admitted into the program had more than 1 year of experience across the span of the specialties. Is this program offered in person or hybrid? This is an in-person program. So there have been talks of the program being offered hybrid or at least offering some classes remotely. But again, our faculty are still putting that and having that in discussion. But as of right now, this is an in-person program. I'm not sure if it's going to be asked for one of the other questions as we continue moving forward, but classes will be during the week. And so they also will try to have the classes back to back. I believe right now they are going to be offered on Tuesdays and Wednesdays. It may differ again, but they try to make it so where depending on where you may be traveling from, if you are inside LA, but maybe a little bit further, or even maybe outside of the LA County, they try to have it to where, hey, you know what days you'll be coming in. If it's back to back, you'll know what you'll need to do. Do you need to have RN hospital experience? Okay, I feel like that's almost the same question. So, no, you don't need to have it. Again, it's not required, but it is highly recommended to have RN experience. So, RN experience, hospital experience should be pretty much the same thing. But it is not required, but it is highly, highly recommended. Is transfer credit accepted? Yes. So the university, right? So UCLA Graduate Division does accept transfer credit. They accept up to, I believe it's 8 units, 6 to 8 units, but it's not much. I believe it's 8, but it's not much. And so that in essence, could come out to 1 or 2 classes, right? But that will also be determined if the transfer credit is equivalent to what the classes are being taught in the program. And so if you believe there are some classes that you may have completed in any other program, it's a BSN or even a master's program that you think is comparable, we will have our faculty take a look at it. Most likely have to look at a course syllabus to decide the transfer credit or the acceptability of that. Next question is, can you work while you're in the program? Yes, you can work while you're in the program, but you have to think about tailoring. If you do decide to work, tailoring your work schedule around your school schedule. Okay, because our faculty do want us to reiterate that this is a full-time program. And that there's going to be not only the theory and the lecture coursework that you're going to be required to do, but then also your clinical hours as well. So they don't want to say don't work because we all know we're going to have to work, but you do have to put school first, at least for these next few years, and have to tailor your work schedule around your school schedule. How often do you admit students? So we admit students once a year. And so we admit them for every fall. So students are admitted every fall. So the next time we'll be bringing students in is going to be for fall 2026, 27, 28, and so forth. So unfortunately, we do not have a spring, summer, or even a winter admit term. How many students do we admit per specialty? This is a really good question here. So we're going to admit 7 students per specialty. Okay, so it's going to be a total of 28 students. So 7 for the adult gero primary, 7 for the adult gero acute care, 7 for family, and 7 for the peds dual. What is a minimum GPA? So the university requires students to apply with a minimum GPA of a 3.0. And that's going to be from your nursing or your undergrad. Well, it's going to be twofold. It's either going to come from your undergrad degree, right, from your BSN if you have that, and or your master's entry. Okay, so we'll be looking for a 3.0 minimum. If you do not have a 3.0 minimum, it does not mean you cannot apply to the program. You can still apply. We can still admit students who have a GPA under a 3.0, but obviously other parts of the application are going to have to be strong for us to justify to graduate division in terms of why we would like to admit someone that did not meet the minimum GPA. Also with the GPA, it's going to be cumulative, okay? So that will be the cumulative GPA from your nursing degree. Is there a wait list? So yes, we will have a wait list. So we will have our initial 7 students that we're going to admit, again, for each specialty, and then we're going to create a wait list from there as well. So the wait list, in terms of the number of how many on the wait list, will just depend on the number of applicants that we receive from the program for each well, from the program, but from each specialty. Now, some people may be asking or thinking about how many people apply to each specialty. And so I can get these numbers right. Actually, I won't give you, I think I know them off the top of my head. I think adult, for the adult Juro acute care, we had 24 people that applied, again, for 7. For family, we had 35. And I think for the adult Juro primary and the peds, we were around 12 to 15, somewhere around there. And so it falls in line with the numbers in terms of what it looked like for when we were offering our advanced practice program. So we typically will receive more applications for the family as well as the acute than we will for peds or Juro primary. And so with that, depending on how many people apply, we will determine how many people we want to add to the wait list. I will say for students that are getting ready to start this fall, we did grab people from our wait list for each specialty. Okay, so just so you guys know, if you do make the wait list, you do have a really good chance of also being admitted into the program. Okay, so before I continue on to the application procedures and the application, I'll do a quick pause just to see if anyone has any questions that you would like for me to answer. So I'll take a quick pause here. Okay, so it looks like here. Okay, awesome. Yeah. So thank you for writing this out. It looks like you're asking the difference between the different statements. In terms of the statement of purpose, we're going to have a personal statement, and then there's also for the DNP, there's also another subset of questions as well. So I'll make sure to talk about the difference between those. It may look a little bit different in terms of the DNP packet, but I'll make sure to try to elaborate on what those questions are, how to think about answering them as well. Okay. What does the average student who entered the 2025 cohort look like with respect to work, demographic, age, and so forth? Okay, we haven't really broken that down yet, but from memory, it's going to be, again, depending on the specialty as well. We're going to have people that are going to be coming from all over pretty much the state. We have a couple out-of-state students that are getting ready to start with us. But most of them, again, are going to be having, I think their years of experience fell anywhere between 3 to 5 years of work experience. We didn't really calculate an age. For us, age doesn't really matter as well as gender or anything like that. But majority of the students, I'm assuming, are working adults, especially when they have the multiple years of work experience. But again, they're going to be individuals that have an understanding again of what specialty they're interested in, right? And how that applies to the work experience. So I'll talk a little bit about that as well when it gets to like the statement of purpose, stuff like that. Okay, someone's asking what workload is realistic while being in the program? Is it part-time or per diem? So that's a really good question. I would say either one, right? So either one, if it's part-time or per diem, whatever your hospital or your manager is okay with you doing, I think that is totally fine. It will most likely be hard for someone to work full-time while also being in the program full-time, but then, it also depends on your, responsibilities, time management, right? We're going to have some people that, have families, or people to take care of, right? Or the need to work more than others. So of course that is going to determine, on the person, but I feel safe saying part-time or per diem will allow you to be also successful while still attending the school. Okay, someone's asking, how many people did we grab from the wait list? It does differ per specialty, but I believe for peds, we got to about number 4 on the wait list. F&P, I think we only got to number 2 on the wait list. Acute care, I believe we got to about 3 or 4, as well as the adult general primary. So we got about top 5 for each one. But for family, knowing that that's probably our most competitive and more sought out specialty, we admitted less people from the wait list, which means majority of the students that were offered admission said yes. Okay. Does your program prepare one for the CNS certification? So that's a good question. Unfortunately, we're not going to be offering the CNS certification throughout this post BS to DNP program. We did offer CNS for our advanced practice NP for our master's, but unfortunately, we're not offering CNS as of now for our post BS to DNP. Okay, another good question. Does our school help arrange clinical placements? Yes. So we do have a clinical placement team that will work with you, the student, on receiving your clinical hours, potentially even at the hospital that you are currently working at. So yes. Oh, and I see someone else that almost that same question. So no, as a student, you're not going to be required to find your own clinical sites. Okay, how often do we meet each week? Twice, so Tuesday, Wednesday. So yeah, that will most likely just be your theory and your lecture courses. That's not going to include, you may be having to come for study groups or, come in to write papers, whatever the case is. And that does not include your clinical rotation. So that will also be separate as well. So again, that will be determined on your preceptor and the person that you'll be working with in terms of receiving your hours. If depending on how many hours you'll have to do for that quarter, and then breaking that down in terms of how much or when you want to get that done. But at least 2 days in terms of coming to campus. Okay, another good question. Will you guys be offering the psych mental health option in the future? We're not sure if we'll be offering it for the post BS to DNP. We currently do have a psych mental health NP, but it's a postmaster's, and that is something that's offered through all of the UC schools of nursing. But so that is a separate program, but there has not been talks in terms of adding it to our DNP. Okay, let's see. Let's see. All right. Also, can you comment on how the financial support offered in terms of TA scholarship? Yes, I'll leave this question here. But I believe we have it on one of our last slides. So I will definitely talk about that. Let's see, we'll get a couple more questions in before we continue. Okay, so I was asking, can you share more about the types of clinical sites and partnerships through UCLA? So yeah, I think it just depends on where the individual is working. But it could be obviously UCLA Health, which is Reagan, Santa Monica, or even Torrance. There's Kaiser, there's VA, there's Cedars, there's Children's Hospital of Los Angeles. So there's a lot of partnerships that we have. Again, if you are outside of the LA area, we may potentially be able to partner up with that hospital as well. Again, so if it's at a hospital of your choice, or if you would like to do it at another area, and I see you also commented the underserved, and so yes, communities, and so yes, we have a clinical placement team that will try to ensure for you to get your hours done where you would like. So as long as we can find that partnership and that hospital is willing, then we should be okay. Someone is asking, we partner with Huntington Hospital. I'm not sure, actually. I'm not sure if we are. And or the Los Angeles General Medical Center, I believe we are. But it's more about a specific partnership may not be the right word in terms of saying all of our students, like we send most majority of our students there, but it could be like, hey, we have a student that is currently working at LA General, right, or Huntington Hospital. Is it okay if we allow them to get their hours done there? I'm thinking Huntington Hospital and or LA General, I think we have in the past for our postmasters DNP, but again, I'm not sure what it's going to look like right now moving forward for our new post BS to DNP. Okay, let's see. Da, 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 da. All right, all right. Okay. Sorry, I just saw two come in. If you graduated from a BSN program more than 5 years ago, do you still qualify for the program? Yes, of course. So this program does not have a time limit in terms of when you've graduated with your BSN or your entry-level MSN. That's totally fine. So no time limit in terms of your degree. Someone's asking, why is the master's NP program no longer provided? Yeah, because our faculty wanted to focus on this new program. And then knowing that you'll be getting your NP along with your DNP, they wanted to focus on the doctorate program instead of offering an NP as well for the MSN. So we're transitioning out of that MSN. We think we have our last cohort that's getting ready to graduate this after this academic year, and then we'll be focusing on this DNP. So good questions, y'all. Please keep the questions going. I'm just going to continue right now with the application procedure. And if you have more questions, please feel free to continue putting those in the Q&A, and Jamie and I will continue answering those for you. All right, so first and foremost, I'm not sure if anyone had logged into the graduate application website to see if they can start the application. We thought it was going to be open after September 15th. A graduate division even put it on their website that they were going to be opening the application after the 15th. Well, it looks like this morning they changed it to October 1st. So it looks like we're still going to have to wait a couple more weeks, which means they probably need more time to, kind of work out the kinks and the bugs and whatnot before they feel comfortable opening the application. So if you try to log in and get that going, unfortunately, it looks like we're still going to have to wait a couple more weeks. But again, to get to the application, you will go to grad.ucla.edu. With that, it is going to be asking for an application type. So I'm thinking majority of us here are going to be new, readmission, or renewal. Even if you graduated from UCLA as an undergrad, you're still going to be a new applicant because you will be this will be your first time applying for a graduate program. Okay, so you still will be new. And then also for the major program, what you want to think about, well, not think about, what you want to do is ensure that you're selecting the right major. In the School of Nursing, we have several different grad programs. So we're going to have our nursing Meccan, which is our master's entry program. We're also going to have our nursing PhD. You want to make sure that you're selecting this nurse post BS-DNP because then it's going to then trigger the application system to making sure that you're going to be selecting or going to be entering and completing the right application. So with that, as you do that, it's then going to ask you to select one of the tracks. If you remember, I was telling you that it has a drop down where you're going to only be able to select one of the specialties. And so you're seeing here the snapshot or the screenshot picture of what it's going to look like in the application. So again, if you have a drop down, it's going to say, hey, you're selecting the nursing post BS to DNP. Please select from one of the four options. So again, in no particular order, it's going to be the adult general primary care, acute care, family, and the pediatric dual. Next, it's going to ask you to input your transcripts. And so it's going to say, hey, in chronological order, if you can, please list the institutions in terms of where you graduated. And so again, if you've graduated from multiple institutions, please put those down. I believe it's probably going to be like a filter. So if you start typing it in, it should populate it for you. And then once you do that, it's going to ask for you to upload your unofficial transcripts from that institution. We're also going to ask for you to upload the institutions where you've completed your prerequisites and/or if you even transfer from a community college, please feel free to put that up there as well and upload that unofficial transcript. So no official is going to be required at the time of application. But if admitted, we will ask for you to submit your official transcript. So that will be part of your admission packet. So you don't have to worry about remembering that now, but we will send you a notification as part of your welcome letter to say, hey, we're going to need your official transcript. So at the time of application, you'll be able to upload your unofficial transcripts. So here are some of the admission requirements. So some of these things we've kind of stated already, right? So the first, right, is the completion of your bachelor's or your master's degree from an accredited institution, right? The minimum GPA is going to be 3.0. We're also going to ask for a status of your active RN license here in the state of California. You're not going to need it at the time of application, but if admitted, you will need to submit your RN license. So there may be some individuals that are out of state, or maybe even international, and that's okay as well. So we do accept international applicants, but you will need to, before starting the program, provide us with your active CA RN license. As we've kind of been talking about earlier, right? 1 year of our experience is strongly recommended. 2 within the specialty of interest is preferred, but again, is not required. But from a competitive standpoint, you want to make sure that you do have some type of current experience. There are going to be 3 different essays that you're going to have to write. One is going to be the statement of purpose, the personal statement, and then there's going to be one specifically to the post-BS-DNP. So it's going to be 2 essay questions. They're going to be short answers, but they will be built in as well. And then we're going to be asking for 3 letters of recommendation and then a resume. All right, so what do we look for, right, in the applicant? Here are just some of the things that we want you to start thinking about as you are processing, yeah, I'm ready to apply or I'm thinking about applying. And then also think about how these bullet points can help answer your statement of purpose questions, as well as your personal statement and or your essay DNP questions. Okay, so first, right, is have a self-assessment for potential success in your graduate and graduate study, as well as your advanced practice specialization, right? So again, think about how you will be successful in our grad program, as well as the specific specialty of choice. Also, think about why you want to apply to UCLA, to the School of Nursing, to the actual UCLA Josie Wynn School of Nursing, as you guys may have heard of. But then also think about what is it about us here in the School of Nursing in terms of how we can provide your success, right? So how do we align with your success in terms of what you want to do? With that, we want you to state your goals, right? So demonstrate an understanding of what the DNP program is, right? Again, how that aligns with what you want to do in the future and where the, DNP kind of practice is going, where it's going in terms of the nursing community, healthcare community, and again, how that outlines in terms of what you want to do with it. Also, think about your clinical experience as a registered nurse, right? And then again, how that aligns with the specialty of choice that you want to apply to. We also want to know a little bit about yourself as well. So leadership activities, qualities, right? If you can. It says in parentheses, help indicate the duration, right? So in terms of what you've been doing, if you're part of any organizations, associations, anything that is related to nursing, inside of work, outside, please let us know what that is, what that entails. And then also multicultural and kind of diversity experiences, right? So in terms of who you are, what you're doing in your communities, I know someone talked about underserved areas, right? So are those things that are important to you? If so, talk about those. And then also examples to responding to challenges, right? Or adversity. Some examples, if it's economic, if it's social, if it's educational, disadvantages or adversity, right? Social disadvantage. An example would be is if you're first generation. So talk about those, responding to challenges, how that has helped impact you from a personal and professional level, in terms of helping you be successful, and then how that has also helped prepare you for wanting to apply to graduate studies as well. So with that, so the statement of purpose, okay, so this is going to be the first part essay in terms of your application, right? And so this here is going to help Leonie Thomas, who is our Director of Financial Aid, help her in terms of how we want to consider our students for the merit-based financial support, right? And so again, we want to make sure that, again, you understand your academic interests, right? And then how that has helped prepare you for graduate studies. This will be about 1,500 words in length, so it's going to come out to be about 3 pages, single space. I believe, again, it's going to be, we won't know until the application opens, but I believe last year it was word count. I think it was where you're going to write it probably in your Word doc, and then you'll probably have to copy and paste it in. We're not sure what it's going to look like, right, until we actually are able to get into the apps ourselves, so we don't have that yet. So it could be a word count or maybe an upload button, right? We're not sure yet. So it will be about 3 pages or 1,500 words in length. Okay, think about this. So you do not have to answer every question, right? But you really want to focus on the elements that you think are the most relevant to your candidacy, right? And so again, they will be asking you specific questions. Here are what the questions were last year. So again, we do believe they will be the same following this upcoming admission or application cycle. But again, we won't know until a couple of weeks. But then think about, again, you don't have to answer all of these questions. But think about from the slide in terms of where I talked about, if I can go back, right? What we look for in an applicant. Okay, self-assessment, your reasons for UCLA, stating your goals, clinical experience, your leadership, multicultural experience, as well as responding to challenges. Think about how some of these questions, because these questions may be generic, right? Because they don't know if you're applying to nursing, if you're, applying for a doctorate of education, wherever the case is, right? But one of the questions is, what is your purpose for applying for graduate study in your specific degree program? Describe your area of interest, including subfields and disciplinary interests, right? So it's a generic question, but what you want to do is tailor it to nursing. Another question is, what experiences have prepared you for advanced study or research in this degree program? What relevant skills have you gained from these experiences? Right? Another question, what additional information about your past experience may aid the selection committee in evaluating your preparation and aptitude for graduate study at UCLA? Why is UCLA graduate program to which you are applying the best place to pursue your academic goals? So again, right, these are going to be kind of generic questions, but again, you want to tailor these towards why, obviously nursing and the DNP. Again, you can answer any of these that you like, but what I would suggest is not have it be, hey, question 1, answer, question 2, answer, question 3, answer, 4, and so forth. I would recommend, or Jamie and I would recommend that you get creative, right, in terms of how you write your statement of purpose. Um, uh, have it be unique, paint a picture for us, right? Make sure that the reader, the reader is grabbed, right, from what you're writing in your statement of purpose, as well as your other essay. So yeah, try to refrain from just saying, hey, questions 1, 2, 3, 4, and 5, answer. Have it really grab us. For the personal statement. So this one here is something that Leonie, for our Director of Financial Aid, is also going to use, right, in terms of the different scholarship opportunities that the university has to offer. More specifically, it's going to be our Cota Robles and or the Graduate Opportunity Awards. So there's many different scholarships that are going to be awarded. But the personal statement is where you just want to get personal, right? Kind of feels self-explanatory. But this is where you're really going to let our faculty and our evaluating committee really get an understanding of who you are. This one is shorter though, so this one is going to be 500 words in length. Okay, so the statement of purpose is going to be longer compared to the personal statement. But then again, here are just some of the questions that they'll be asking you that you'll be able to answer. Again, you don't have to answer all of them. Answer the ones that you think are most important. But again, these do tie into some of the things that we're looking for specifically in the School of Nursing, right? So, first question is, are the educational, personal, cultural, economic, or social experiences not described in your statement of purpose that have helped shape your academic journey? Describe challenges or barriers that you have faced in your pursuit in higher education, right? So again, that's talking about, challenges, going through adversity, things like that. Have you been actively engaged in programs, activities, and focus on increasing participation by groups that have been historically underserved in higher education, right? So that's multicultural experience, that's diversity, that's your leadership, and so forth. So again, you want to tie in the things that we are looking for specifically in the School of Nursing and how you can help answer these questions. Again, for the statement of purpose and the personal statement. It looked like last year it was an upload. So as you can see, you'll type it in and then you'll upload your personal statement to the application. It may also be like that again this year. Again, we won't know if it's going to be a specific word count or if it's going to be an upload feature. Okay. And for the last essay, sorry, there's going to be 3 different ones, but this one here is specific to what our faculty are asking for our students, or potential students in terms of answering these questions specific to the DNP, right? So within 500 words, so it's not 500 words for each question, but 500 words in total. So they know that you have to do a statement of purpose and a personal statement. And so they're adding an additional one, but think about writing about 250 for each question, right? So first one is to just briefly describe specific situations when you have engaged in teamwork, leadership, or collaboration with people from diverse disciplines and perspectives. And then also briefly describe specific situations when you have engaged with others to advocate for individuals, family, patients, communities, populations, and other system changes. So again, it's slightly different, right, in terms of what's required for you to write for, again, a statement of purpose and personal statement. And so they want you to focus a little bit more on the collaboration, right, in terms of what you've been doing in your clinical aspect, in terms of how that's also going to work in terms of when you earn your DNP. Okay, let's do a quick pause to see if there's any questions about these statements. Okay, nothing yet. Okay, so I'll keep going. I do see some questions, but we'll definitely get to these. Okay, so for the resume and or for the CV, it's up to you in terms of how you would want to create or submit your resume or CV. But basically, what we want you to do is list it in chronological order, detailing your work history from professional and or volunteer experiences. We also want you to include leadership, advocacy, teamwork, collaboration roles. We want you to include things that are maybe outside of your work experience or healthcare experience, right? So if you've volunteered, if you've done any community service, other creative experiences, please list it all. Okay, so we know, work resume is typically 1 page, right? Extended. Be 2 pages typically is probably what applicants submit. It could even be 3, right? So you determine if you want to do it as a CV or a resume, but we want you to include everything that you can because it's really going to give our faculty another set of eyes in the sense of understanding who you are as a person and as a potential student. For letters of recommendation, we are going to ask for 3. We do say have them be people from a professional setting, so just no family or friends. We try to give you an outline in terms of maybe potential people you should use. So if you can, use at least one nurse supervisor or manager if you feel comfortable, right? Depending on how long you may potentially been at your current position. If you feel that person doesn't align with your future goals, we wouldn't suggest using them, right? So we, first and foremost, choose the best 3 that you think would be people that can write not only the best letter for you, but again, will show a different side for our faculty to get and then another sense of who you are, right? So your current employer is highly recommended, but again, if you just started working maybe somewhere and you don't feel comfortable asking them, you can use a past employer. But we really just want, again, for you to choose people that you feel are going to write you the best letter recommendation. The letter recommendations do work a little bit differently though. So again, this will all make sense when you get into the app. But what you'll do is it's going to ask for you to include your recommender's information. So their name, potentially where they work, and their email address. It's also going to ask for you to also select the recommendation form. So you want to make sure that you're also selecting the right letter recommendation form. So you're going to be selecting nursing DNP recommendation form. So you want to make sure that once you enter their information, they're going to get the correct form. Once you add them, just like any other email, it will take them a few minutes for your recommender to receive an email with a link to complete our recommendation form. It'll ask, several questions, some generic kind of questions. It shouldn't take them more than 5-10 minutes to complete the recommendation form. And then they'll also have the opportunity to upload a letter as well. Okay, so they have to complete our form, but a letter is something that is optional. Okay, let's see. I do see a couple of questions coming in, so let's take a pause because I'm assuming it might be about the letter of recs. Okay, yes. Let's see, sorry. If we recently have a new manager, would you recommend using a previous manager? Yes, if you do not feel comfortable having your new manager write you a letter of recommendation. Yes, that would be okay. And does it mean that I need two reference letters from nursing professionals? No, it does not. You can use more professors if you feel they are more viable to write you a letter of recommendation. That's okay. But again, if your current employer, when I say current employer, that also means like, your nurse supervisor, nurse manager. So it's really one if you would like it that way. And then you can use professors. But again, if you've been outside of school for several years and would not want to use a professor, that's okay as well. Okay, someone is asking, can letter of recs be submitted after the application deadline? Yes, they can. We are actually going to have that in probably one of the other slides, but we're going to have a January 15th deadline for recommenders. Does a clinical instructor in your BSN program count as a nursing supervisor? It could. It could, but when we're talking about nursing supervisor, we're currently talking about working as an RN. But if you do like that instructor in terms of your BSN program, you can have them write you a letter of recommendation, but our faculty most likely wouldn't look at them as a current supervisor. Yeah, can a care recipient from, IHSS write you a letter of recommendation? Yes. Yes, that's okay as well. And go back, someone's had a question about the resume. Do you require the exact hours for each activity slash work experience on your resume? So it's a good question. No, we don't. No, we don't require the exact number of hours. If you know it, you can put it, or you could just put the duration in terms of how long you completed that activity or that experience. Okay, another question for clarification. Do you need to have your license by the start of the program or the start of your clinicals? So it will be the start of the program. Okay, and I think I saw. Will the December 1st deadline be extended due to the application opening later? No, it will not be. It will not be. You'll still have about 2 months to submit your application. So that should still be a good enough time. Okay, some of the statement of purpose questions relate to research. Is this related to the research that we are going to do or for the scholarly project? Or do we have to have a focus more more of a focus on the clinical practice side? So it's a good question. So you want it to be more thinking about your scholarly project, right? In terms of what research it is that you're interested in doing. And again, think about it doesn't have to be set in stone. Our faculty are going to help flesh that out for you as well. But as you're writing your essay, start to think about how that aligns. Okay, so let's talk a little bit about the prerequisites. So for the DNP program, we are going to ask for 4 prerequisites. We're going to ask for statistics. So we do need a statistics course that needs to be completed within 5 years of matriculation into the program. That means for 2026, the year of 2021 and more recent, it's going to be required for you to complete a statistics course. For any of these prerequisites, including statistics, if you do not have it, you can still apply. You can even still be admitted. But what we will say is, hey, congratulations, you are missing one of these prerequisites. It will need to be completed before starting the program. Okay, so I do want to mention that. Next is going to be a nursing research course. And then we're going to have a physical assessment course or health assessment, depending on, again, what it's offered or what it was stated as from your program. And then there's going to be human physiology. So please note that pathophysiology is not an acceptable substitute for human physiology. And to go back for physical assessment, we do have a list of specific physical assessment courses that our faculty accept. We do have it somewhere on our website. So if your school is not on this website, it will most likely mean that you'll have to retake this course with us during the summer. So we offer a specific physical assessment course for our students prior to starting the program in the fall. Please note that all prereq courses need to be passed with a C or better. Okay, so C or better, no C minus. If it's a C minus, we will ask for you to retake that course. And again, stating that you will need your RN license, California RN license, that is. For international applicants, you will be required to either pass the TOEFL or the IELTS, depending on which one you're interested in taking. And it's from where you graduated from, right? Or from the foreign university where English is not the primary language taught or spoken. If you are thinking of taking the TOEFL, we have the institution code, which is going to be 4837, as well as the intended graduate major code, which is 43. So once you include both of those, it will be implemented into your application. Okay, last but not least, let's talk about the application deadline. So as most of you guys have probably known, and I maybe even stated some of that during today's information session, but we do have a December 1st application deadline. So this deadline will not change. So yeah, unfortunately, yeah, we know the application opening is opening a lot later than usual. I want to say in all of our years doing this, October 1st is the latest that it's ever had an anticipation for opening. But we do feel it still gives our applicants enough time, right, to submit. So it will be December 1st. It won't be November 30th. It will be December 1st before midnight. I do believe the application is on Eastern Standard Time, so that's okay. If you submit it, late December 1st, we'll still accept it, so don't worry about that. And then we do have not extended deadline, but a deadline for submitting accompanying documentation, such as letter recommendations. It could be a transcript, it could be anything, right? So as you submit your application, Jamie, myself will review it to ensure that everything is there. But if there's anything missing, we will let you know, and we will ask for you to submit it by January 15th. Okay. All right, application timelines. So here's something, right, in terms of what we want to show you, what it would look like as get ready to apply, when you submit, to when you'll receive some notifications, as well as the admission decision. So we thought it was going to open up in September of 2025, but it looks like it's now going to be October 2025 as of this morning. We just heard about that. But we're still going to, again, have our December 1st deadline. January 15th, 2026, right, for any missing documentations. Then the applications will go into the review process with our faculty in the month of January and February. And then our goal is to notify applicants in March. And then from there, we will have some cool things for our incoming class, right? So May, we'll have a virtual, new student welcome. And then we'll have our online orientation modules in June. And then in September, we'll actually have our in-person orientation, which our students are getting ready to attend now. So again, just to outline, right, what it looks like from start to finish. So I'll leave this process up here for you to help answer some additional questions we have here. Okay, our reference letters, do they need to be written by current workplace? Does it have to be someone from a bedside nursing? So we do recommend that it comes from a current workplace. And if you want it to be someone from bedside nursing, you can. But again, if you have a nurse manager or supervisor, that it would be our first choice. Can the letter Rex be from someone from an interdisciplinary team member that you work with, such as a doctor? Yes, you can use them as well. But again, if you want to use a doctor, do know that, or not know that, we would hope that they understand the role of a DNP, right? And how they potentially see yourself as a role as a DNP. Okay, do all three letters of rec need to be submitted by supervisory role or just one or three? Yeah, just one of the three, if you can. And then it says, I noticed a previous response of no coworkers. Yeah, so when we say no coworkers, what we really mean is no one lateral pretty much in the same position as you. So that's kind of what we mean by coworkers. Okay, so yeah, so someone's now asking, do charge nurses, RN preceptors, nurse educators, and patient care directors count as a supervisor? It can, again, if they are someone that supervises your role as a nurse, that's pretty much what we want you to think about in terms of them writing you a letter of recommendation. But then also, because a lot of us, a lot of you guys are thinking about who should write it, or like in terms of the title, but also think about who can write you the best letter recommendation, right? That's more of what you would want to think about. Someone that potentially sees your success, not only as a student, but also envisions you as, right, as a DNP. So you want to start thinking about that as well. Okay, if none of the prereq courses are listed on my transcript, do I need to take all of them during the summer semester, or should I complete them during the summer before the program officially begins? So this is a good question. So in all of our years working in admissions, students will have at least should have all of the prerequisites done from their nursing program, right? The titles might be different, but you should have completed a statistics course, a nursing research course, a physical assessment or health assessment course, and a human physiology somewhere. If it was at a community college before you transferred to your, your nursing program or not. But if for any reason you do not have any of these four courses, you can still apply, you can still be admitted, but it does mean that you're going to have to take those additional four courses before you start in the fall. But again, you will be applying, you will be submitting your transcript, and then Jamie and I will be going through it to determine if you have those courses. And if you don't, you will get a notification from us saying, hey, thanks for applying. We have all the documentations needed to have your application move forward, but also know that you are missing these prerequisites and that they will need to be completed before you start. So you will get notifications and emails from us. You will. All right, someone's asking, can you submit more than 3 letters of recommendations? So the application will allow you to submit 4, but we are going to ask that you only submit 3, right? The reason for it is you don't know if you submit 4, you don't know of the 4 which ones or the whatever the 3 best ones are, right? And so we're only going to choose 3. It's going to be almost like a Rochambeau, right? Almost lottery. And so, yeah, you don't want to have one of them be submitted that's not going to be reviewed well from our faculty. So choose your best 3 and have them hopefully submitted the best letter recommendation that they can. So I know there's been a lot of questions. And so I know, we're getting pretty close to finishing up, but we do want you guys to feel free to email us if you have any, questions that may pop up after today, or even when the application does become available, there may be some more questions. And so please feel free to contact us at admissions.ucla.edu. Or if you want to reach us specifically to our own email address, feel free to do that as well. But again, you can reach out to myself, Jamie, or even Natalie. Actually, maybe not Natalie, because she'll be coming back towards the holidays. But feel free to reach out to Jamie or myself. Or if you want a generic question, go ahead and email it to the admissions at sonnet.ucla.edu. Okay. All right. So last part of the session is going to be about the tuition and the financial aid. See if I can move this here. Okay. So here are proposed fees, right? And so when we say proposed, these can change, right? But this is typically what it looked like for the students that are getting ready to start with this fall. You want to think about the mandatory system-wide fees. Again, it's going to be broken down into each year. There's also going to be what's called professional degree supplemental tuition fee, right? Which goes specifically to the program that you're going to be applying to, right? In terms of if it's nursing, if it's education, if it's somewhere else. So this is more specific to us here in the School of Nursing. And then you're going to have some other things, right? In terms of the campus-based fees, there is going to be a summer fee, right? Because an academic year for us is fall, winter, and spring. And then again, you all have to do the summers. So that is going to be a separate fee. And then there's also going to be the non-resident supplemental tuition fee. So this is going to be for anyone that is out of state. Okay, so if you're thinking about the breakdown per year, right? And again, this does not include scholarships, financial aid, loans, and so forth. But the bold here is particularly what you will be having to pay per each year, and or if you are non-resident. Now, let's talk a little bit about financial aid in terms of applying for FAFSA. If this is your first time applying for grad school, you can still apply for FAFSA. The application will be opening up in October, and they're still going to have that priority deadline of March 2nd, as we all know. Well, should know, maybe. You never know if we applied for FAFSA and financial aid as undergrads. The school code, once you get in there, if you just want to pop that in, 001315, it'll populate and it'll bring up UCLA. Do know that there are financial aid that is offered, right? So that's going to be the direct subsidized loan, which could be up to about 20,500 annually. And then there's also going to be the Graduate Plus loan. And so that is based off your credit. And so that will most likely have a higher interest rate, but it will go towards paying off any additional loans that you may have to. So again, you have your subsidized loan, and then you're also going to have your Graduate Plus loan. Do know that we do offer financial support for our students. And so we have need and merit-based scholarships. And so there's going to be a couple, not a couple, when you are in your application, there's going to be a section for financial aid and scholarships. But then also, and that's going to be through the university, but also know we have specific ones through the School of Nursing. And so Leonie, once admitted into the program, she will submit or send you the applications for these scholarships. Also, do know that we do offer, and I believe someone was asking this question early on in the session, so I hope this is now being answered for you. But yes, we do offer TA, which is teacher and assistant, or GSR, which is graduate student researcher. So we do offer this for our doctoral students. Okay, so it's an academic apprentice personnel titles. And so it helps with the fee readmission. Okay, so it can be up to 100% of the mandatory statewide fees. And then you'll also receive a monthly stipend as well. Okay, so this does really help combat, right, the tuition and fees in terms of what's going to be required for you to pay from year to year. And then also for anyone that's part of the UC system, you will be eligible, I should say, to receive 2/3 off the student service and tuition fees. So it's about 66, 67%, which will also help, right? So again, you have to be part of a UC employee. You have to still be career though. So I know someone was asking about per diem, and to my knowledge, per diem does not work as part of this. And so you will still need to be a career employee at part of the UC system. But being able to take advantage of the TA as well as the GSR, and or again, if you are a UC employee, is something that we would highly recommend. Okay, so looking at a question, someone is asking, is the academic apprentice personnel guaranteed opportunity? It's not guaranteed, but if there are TAs and or JSR spots available, yes, we will offer that for our grads, our doctoral students, but it is only doctorals, right? So it's going to be our DNP and our PhD. And so, yeah, is it difficult to get? Not necessarily. It is not difficult to get. It's up to those that are the availability that's open, right? So in essence, once we have PhD students that graduate, right, or we have other DNP students that graduate, that opens up, right, more opportunities for our new doctoral students to come in to take on those TA and GSRs. Okay. What kind of courses do our TAs take part in? Yeah, so it's going to be the role of our masters and or even our undergraduate programs. So yes, you will be helping out with our faculty that we have. So take on, yes, helping with either our BSN or our masters, which is our master's entry. And what percentage? That's a good question. I don't really know the percentage yet. Wouldn't be able to tell you. We'll know a little bit more as we're getting ready for this upcoming year, just because we're having more DNP students this year than we have in the past. Our postmasters DNP, we had about 15 to 20, and then now we're going to be having about 28. So, but to my knowledge from speaking with Leonie, it hasn't been an issue yet. Okay, and so this here again is just to kind of show you, right, what the average loan debt is for, School of Nursing students. as well as the potential salary, right? So it's just to give you an idea of what that looks like. Of course, we don't have it yet because our students haven't graduated yet from our new post BS-DNP, so we're not sure what the loan is going to be like. But we just have this here just to show you that education is an investment, right? So, we broke down potentially what it's going to cost, but you'll be able to combat that with, again, the TA and GSRs and so forth. But again, education is what we always like to say is an investment. Okay, so perfect. We're almost right on time in terms of finishing. Wanted to get you guys out of here within an hour and a half. So we just want to say thank you again for joining us for today's information session. We know we threw a lot at you today, but we do hope that this helped solidify that, again, UCLA Josie Wynn School of Nursing is somewhere that you want to apply. And so we will be excited to work with you throughout the application period. Again, we do apologize knowing that it's going to be opening up, looks like 2 weeks later, but please feel free to reach out to us if you guys have any questions. We are excited. We can't believe we're already getting ready to start this new application cycle for fall 2026. So we'll be here to help you throughout throughout the next several months in terms of the application cycle. So just wanted to say that just in case people do need to take off, but we will still hang on for a few more minutes to help answer any questions. So if you have any, continue to put them in the Q&A, and we'll continue answering them for you. But thank you everyone for joining us. Okay, what time does class in theory usually start? 9 a.m. or what do you know? Because LA traffic. Oh, yes. So yeah, classes probably will start before 9 a.m. It could be 8:30 class. But yeah, it's LA traffic is terrible, as we all know. So there have been students in the past that have, bunked up, with other classmates that, live closer. Also, what I haven't mentioned is there is graduate housing. So probably should have mentioned that we do have grad housing. So, if you would want to move closer to campus, that is an opportunity as well. The university offers single as well as family housing. So we do know that. And then also you have to think about even, not even getting here in the morning, but even potentially leaving, right? Because there's traffic pretty much all day. There have been students who, waited out the traffic and left in the evening. So we do know that sucks. Not much we can do with that. But there have been times people, get roommates or stay with classmates. Class will probably end in the afternoon, 4 or 5 p.m., right? Just depending. So it's going to be when we say, all day, full time, it will probably be about 8 to 5, right? Where you'll have your classes. And thank you, everyone. I see people writing these thank you notes. So we really appreciate that. Thank you so much. Okay, another good question. Has the new administration climate changed any of the GSR or financial aid available to our students? So yes, to full transparency, yeah, the new administration in terms of what's going on from President Trump, yeah, has affected the financial aid that is being offered to students, not just in the School of Nursing, but UCLA as well as other universities. So that has, but we're doing our best in terms of still and our I should say our dean has really done a good job of still trying to ensure that our students are going to be able to receive as much funding as possible. So we won't really know until it's a year by year, case by case basis, but yeah, it definitely has. Okay, and question here, if a certain circumstance comes up in the middle of the program, is there an option to pause for a quarter and continue to the next cohort? Yes, yeah, that's what we call like LOA, which is a leave of absence. So yeah, happens all the time not all the time, sorry, but it does happen where it doesn't matter if it's our undergrad program to our grad programs where people may have to take a leave of absence. So yes, that does happen. And so we work with the student to ensure that they will be able to come back. And we'll have the requisite resources to ensure that they'll be successful once they come back. Okay. Thank you, everyone, again. Appreciate the thank yous. Thank you, thank you. We'll hang on maybe for a couple more minutes to help answer the last kind of questions that you guys have before we let you go. Okay. Okay, yeah, someone's asking again to clarify the charge nurse. Does it count for a supervisory role? We've had people use charge nurses in the past. So, short answer is a yes. But again, do you feel comfortable with that person writing you a letter of recommendation, right? Especially when you're thinking about a doctoral program. So think about it in that essence. Okay, and then it's a really good question. Are full spectrum sexual and reproductive health clinical placements available for F&Ps? I'm pretty sure they will be. We'd have to think about where they are, and if we have a partnership with them. But we have amazing F&P faculty that would be able to help our students with that, with partnership with our clinical placement team. So if that seems like that might be part of your scholarly project and your research, that sounds amazing. So yeah, we'll try to make sure that that helps with you. Okay, maybe one more minute before we go. All right, so we'll go ahead and finish it and conclude today's info session. Again, we just want to say thank you for joining us. We look forward to hearing from you. If it's from an email with some more questions, you want to set up an appointment to meet with us, whatever the case is, we're excited. We just want to say thank you again, and look forward to uh, seeing your app come across in a couple of weeks to a couple of months. But again, thanks again for joining us. Take care, everyone, and have a great rest of your day.